Hello everyone, my name is BJ Iana Rose Pabros, and this video I will be discussing about the skeletal system and demonstrate the location of palpitating surface of the anatomy of the lower limb. The greater trochanter is located at the top of the thigh bone or femur and is most prominent and widest part of the hip. The tibial tuberosity is the bump on the top of the tibia or the shin bone where the patellar tendon connects. Tendon connect muscles to bones. The patellar tendon stretches over the top of the patella or the kneecap. The patellar tendon connects the large quadriceps muscle on the front of the thigh to the tibial tuberosity. The lateral malleolus is the name given to the bone on the outside of the ankle joint called the fibula. The most common type of ankle fracture is a lateral malleolus fracture, which can occur when the ankle is twisted or rolled. The medial malleolus is the bony prominence on the inner side of the ankle formed by the lower end of the tibia. Calcaneus is the bone that forms the heel of the foot and is the largest bone in the foot, providing the foundation for the other bones in the foot and ankle. And now, I am going to demonstrate the movement of synovial joints. Flexion, a movement generally in the sagittal plane that decreases the angle of the joint and reduces the distance between the two bones. Flexion is atypical of hinge joints but is also common at ball and socket joints. Extension, a movement that increases the angle of a joint and the distance between two bones. Extension is the opposite of flexion. If extension is greater than 180 degrees, it is termed hyperextension. Abduction, movement of the limb away from the midline or median plane of the body, generally on the frontal plane, or the fanning movement of fingers or toes when they are spread apart. Adduction, movement of a limb toward the midline of the body. Adduction is the opposite of abduction. Rotation, movement of a bone around its longitudinal axis. Rotation, a common movement of ball and socket joints, also describes the movement of the atlas around the odontoid process of the axis. Circumduction, a combination of flexion, extension, abduction, and adduction, commonly observed in ball and socket joints like the shoulder. The proximal end of the limb remains stationary and the distal end moves in a circle. The limb as whole outlines a cone. Pronation, a movement of the palm of the hand from an anterior or upward facing position to a posterior or downward facing position. This action moves the distal end of the radius across the ulna so that the two bones form an X. Supination, movement of the palm from a posterior position to an anterior position. Supination is the opposite of pronation. During supination, the radius and ulna are parallel. Inversion, a movement that results in the medial turning of the sole of the foot. Eversion, a movement that results in the lateral turning of the sole of the foot, the opposite of inversion. Dorsiflexion, a movement of the ankle joint in a dorsal direction. Plantar flexion, a movement of the ankle joint in which the foot is flexed downward.